Alright, so this is Elizabeth Hasted. I'm just going to do a video of basic cow auscultation. This is Charlotte. Hopefully she's really sweet and going to let me get all the basics. So with the heart sounds, you want to place the bell of the stethoscope right between the ventral aspect, the ventral part of the thorax where the heart is located. You want to place the stethoscope between the upper foreleg and the chest wall, between about the 3rd and 6th ribs. And just try to listen to any rate, rhythm, and heart sounds. It's a little trickier on cows and on a small animal because of just the size and the size of their chest. Alright, so hopefully, hi Charlotte! Oh, I don't drop the stethoscope. So you just want to listen to a normal rate and rhythm on a cow, most cows. So there's my stethoscope. Most cows are between 60 to 80 beats per minute. Okay, she's at right about 68 to 72 beats, so that's totally normal. Alright, and tachycardia could be caused by different things such as heart disease, some infectious diseases, things like that. Bradycardia, which is about 40 to 60 beats per minute, could be caused by vagal indigestions. Muffled sounds could be pleural or pericardial effusion. Alright, and so going on to the lungs. Just want to get a quick look at her respiratory rate, see if I can back out a little bit. Yeah, she's pretty big. Hi, honey. Alright, just want to watch her breathe. Okay, most cows can be between about 8 or 12 to 20 breaths per minute. She's at about 12 to 16, so that's totally normal. Also, with respiratory, so you want to listen to just right in this. I don't know if you can see, right in this area here, and that's when where you're gonna get the best lung sounds from them. You just want to listen for any cracks, wheezes, things like that. Those are all abnormal. So we're just gonna give a quick listen. Hi, pumpkin. Okay, everything sounds really nice and clear, so that's good. Alright, and then with the rumen, you just want to listen to the contractions. The stethoscope is going to be in the left paralumbar fossa, which is right about here on her, just kind of this triangular space. Alright, normal contractions usually happen with about 1 to 3 per minute. They should be strong and be able to be felt and seen. Any small pulses, if it takes too long, things like that, you want to worry about that. There may be trouble with the rumen. So we're just going to listen up. You always want to do it on the left side. That's when you're going to hear it the most. Oh, girl. Hi, honey. You just want to listen for a light ping. Alright, and there it is. Alright. So that is auscultation of a cow. Alright, and so thank you, Charlotte, for being such a good sport for all of this.